A lot of profits can be reaped by convincing healthy individuals that they are unwell. Contrary to the fundamental goal of promoting well-being, the medicine industry, the very entities entrusted with safeguarding our health, may have a vested interest in our ailments. How much truth lies beneath the surface of our prescription bottles, and to what extent are we unwittingly contributing to our own maladies? Join us as we the mystery. Why does the Western medicine industry want us sick? Profits soar when healthy individuals are convinced of their illnesses, marking a shift towards what is now termed disease-mongering in the medical realm. This phenomenon extends beyond the medicalization of ordinary life, evolving into a strategic widening of the boundaries of treatable illnesses. The motive? To create expansive markets for those vested in selling and delivering treatments. At the heart of this controversial practice are pharmaceutical companies, actively shaping the definition of diseases and vigorously promoting them to both prescribers and consumers. In this landscape, the social construction of illness gives way to a corporate construction of disease. While certain facets of medicalization spark ongoing debates, the intricacies of corporate-backed disease-mongering have largely eluded critical examination. In 1846, a Hungarian doctor working in a Vienna hospital faced a perplexing problem. A significant number of new mothers in the obstetrics ward were dying from puerperal fever, and the cause was unknown. The medical practices of the time were vastly different from today, with doctors attributing illnesses to bad odors and miasmas. The hospital had two wards for women giving birth, one staffed by doctors and the other by midwives for those who couldn't afford a physician. Surprisingly, the midwives with less training had a much lower mortality rate for the fever. Desperate to understand the difference, the doctor tried changing birthing positions and even considered the impact of a bell-ringing priest. Nothing worked until a friend, also a doctor, died after an autopsy on a fever victim. It became clear that puerperal fever wasn't exclusive to women, and germs were likely spreading through contact. The breakthrough idea was simple: hand washing. The doctor ordered the staff to use a chlorine solution, unaware of its disinfectant properties. The results were astonishing, with the mortality rate dropping significantly. However, when the doctor shared these findings, the medical community rejected the idea. Despite the evidence, doctors refused to believe that washing hands could prevent illness. The doctor faced backlash, was fired, and eventually suffered a mental breakdown, leading to admission to a mental asylum. Ironically, a cut on the doctor's hand became infected, resulting in untreatable sepsis, echoing the fates of the women the doctor had tried so hard to save. Decades later, doctors and researchers developed the germ theory of disease, understanding that bacteria and viruses, not odors and miasmas, cause illnesses. Unfortunately, Ignaz Semmelweis, who championed hand-washing as a preventive measure in the 1800s, didn't live to see the validation of his ideas. By 1998, washing hands became standard care for doctors. Nate Jones, the CEO of Clear, notes that during the recent pandemic, simple saline and xylitol nasal spray showed positive effects in treating the virus. Clear faced challenges in sharing scientifically backed claims due to government restrictions. Jones emphasizes that medical advancements often face resistance, as was the case with Semmelweis. In the current context, information that could save lives might be suppressed for various reasons. Dr. Sarah Jo Baker, a pioneering female doctor in the early 1900s, faced similar challenges. Despite the acceptance of germ theory, she encountered resistance when trying to promote basic hygiene, especially in New York's impoverished districts. Dr. Baker's initiatives, such as educating mothers on newborn care and hygiene practices, resulted in a significant reduction in infant mortality rates. Despite these positive outcomes, Dr. Baker faced opposition from doctors who relied on treating sick babies for profit. Her preventive approach disrupted their business model. This resistance highlights a recurring theme in medicine: pushback against progress due to ego and financial interests. In the present day, many people pursue a career in medicine due to the financial rewards, with the average doctor earning around $265,000 annually. However, in Ignaz Semmelweis's time, becoming a doctor was not a lucrative decision, as doctors earned only a few dollars per patient, and there wasn't always a steady stream of patients. The primary concern for doctors in the 1800s was not money, but rather their reputation and ego. A doctor's status was paramount, and new, young doctors challenging established practices faced resistance, regardless of the validity of their discoveries. Over the years, doctors' earnings increased significantly, making it a comfortable profession by the 1900s. However, the focus on treating diseases rather than preventing them persisted. Organizations like the American Medical Association, AMA, while claiming to promote the science and art of medicine, primarily safeguarded the interests of their members, ensuring doctors continued to earn substantial incomes by treating illnesses. Nate Jones, the CEO of Clear, suggests that the fear of preventive measures might be rooted in the financial interests of the medical establishment. Preventing diseases could potentially reduce the need for medical interventions, impacting doctors' income. He argues that if doctors were more effective at keeping people healthy, the demand for medical services would decrease. Nate discusses the reluctance of the medical community to embrace preventive measures. He introduces the concept of nasal hygiene, emphasizing the importance of cleaning the nose to protect it from viruses and bacteria. Nasal hygiene, achieved through products like Clear's nasal spray, is presented as a simple yet crucial practice for overall health, challenging traditional views on disease prevention. Tricia O'Heir, a dental hygienist with 50 years of experience and president of O'Heir University, sheds light on our modern lifestyle's impact on our respiratory health. She emphasizes the remarkable function of our noses in purifying the air we breathe by trapping particles with mucus and effectively combating viruses and bacteria. Tricia highlights the chronic dehydration caused by factors like excessive caffeine intake and air-conditioned or heated environments, leading to more upper respiratory problems. When individuals seek medical help for congestion, doctors often prescribe decongestants or nasal steroids, which, though providing relief, may suppress the immune system's natural response of creating mucus. To combat threats like viruses and bacteria, she connects various health issues, from ear infections to asthma, back to the nose, suggesting that discussing nose hygiene, especially utilizing xylitol, a natural sugar alcohol, could be pivotal. Xylitol, when applied to the nose, helps block bacterial and viral adhesion, reduces inflammation, and assists in expelling mucus from the nasal passages. Tricia points out the medical community's focus on treating rather than preventing diseases, which often sidelines discussions on nasal hygiene. She advocates for the use of xylitol-based nasal sprays, citing her positive experiences and the pioneering work of Dr. Lon Jones, Nate's father, who developed a xylitol nasal spray. She recommends integrating nose washing into daily hygiene practices, similar to brushing teeth or washing hands, to effectively clear contaminants and debris from the nose. She also promotes Clear's xylitol nasal spray, emphasizing its accessibility and affordability in various stores. Tricia sheds light on our modern lifestyle's impact on our respiratory health. She emphasizes the remarkable function of our noses in purifying the air we breathe by trapping particles with mucus and effectively combating viruses and bacteria. Unlike some dentists who may view preventive measures like xylitol as potentially reducing their business, hygienists, including Tricia, are dedicated to preventive care. Tricia has been a pioneer in promoting preventive strategies through her contributions to dental magazines. Tricia ventured into independent publications with Perio Reports and Hygiene Town. Her focus has been on prevention, aligning with the hygienist's commitment to maintaining optimal oral health. This is how, through preventive measures, one can save oneself from the lies of the medical industry. The overprescription epidemic in modern medicine poses a significant threat to public health. According to Peter Gutsche, a co-founder of the renowned Cochrane collaboration, prescribed medications rank as the third leading global cause of death, following heart disease and cancer. In the UK, the use of prescription drugs has reached unprecedented levels, with nearly half of adults relying on at least one medication and a quarter taking 3 or more, a surge of 47% in the last decade. It's noteworthy that life expectancy in the UK has plateaued since 2010, marking one of the most substantial slowdowns among the world's top economies. The NHS faces immense pressure in managing largely preventable chronic conditions like heart disease, high blood pressure, and type 2 diabetes. Type 2 diabetes, which is potentially reversible in up to 60% of patients, consumes around 10% of the NHS budget. A concerning report from the British Heart Foundation predicts a surge in heart attacks and strokes in England over the next 2 decades due to the escalating prevalence of diabetes. Rather than tackling the root causes of these conditions through lifestyle changes, our focus remains on medications offering, at best, marginal long-term benefits for individuals, most of whom experience no improvement in health outcomes. The truth is that lifestyle changes not only reduce the risk of future diseases, but also yield positive effects on quality of life within days to weeks. Unfortunately, individuals experiencing side effects from prescribed medicines may witness a decline in their quality of life, all for the sake of small, longer-term benefits from the medication. If you liked the message, consider liking the video and subscribing to our channel.